and welcome to Module 4, which is Medications and Xerostomia. A few medications that I like to go over that are common with your cystic fibrosis patients may be tobramycin, albuterol, and pulmazine. So if they're taking any of those medications, it's common that they will have xerostomia, which is also known as dry mouth. So when someone has dry mouth, how am I going to know? So things you can find in the mouth when you're doing an intraoral exam would be shiny gingiva. So if their gums appear to be because essentially the oral cavity should be filled with saliva, so it should not be shiny. So if you see it's shiny, that's a sign of dry mouth. And another thing you could see is when Kate was doing the intraoral exam, she used the gauze to check the tongue, and she also used it to check the salivary ducts. So another thing you could do is take that gauze, and if you're inside the mouth and you're finding that gauze is getting stuck, that is the problem. That is a sign of xerostomia. Another sign is decreased salivary flow. So your patient will tell you, my mouth feels dry, or you will notice that maybe sometimes their tongue is getting stuck on the roof of their mouth. It feels like sandpaper to them. So you can just ask them in general, do you feel like your mouth's dry? And they'll let you know. So in the next segment, I will be showing you products that will help decrease xerostomia. The first thing I'm going to cover is water. Water is going to be a very great option for your patients who are seeking something that is relatively cheap and easy to access. And you want to make sure that your patient is drinking water that has fluoride in it, and you would find that out if they're drinking tap water. Bottled water also sometimes contains it, so just be aware of that. Sipping on water is going to be very helpful to them. It's going to help alleviate any dryness that they're feeling in their mouth, and they can sip on that throughout the day. Second option is sugar-free gum. Here we have extra, and it says sugar-free, and these icebreakers are also sugar-free, and it has a very important ingredient in it called xylitol, and what that does is it helps to decrease the amount of the bad bacteria in your mouth. So that's why these products here are great you can also sip on water and also chew gum throughout the day. And our third product here is, if we're looking for something a little bit more pricey that's going to do a better job overall, is Biotene. So Biotene is a brand that offers several different products, and one here I have is a dry mouth rinse. So it's just like typical Listerine, except it's going to help alleviate the dryness that your patient may be feeling, and they can use that up to 5 times per day. The second product we have that's also Biotene based is a gel. So what you're going to do is you just open it, and you would squeeze the gel onto your tongue and rub it around your mouth and then spit afterwards, and that should help to relieve any symptoms for up to 4 hours. So these 3 options are very great for your patient depending on what price point they are willing to go to help alleviate their pain. So this is Module 4, and we hope to see you in Module 5.